Let's now talk about combined hot and cold patterns as we continue our discussion on diagnosis according to 8 principles. Combined hot and cold patterns have symptoms of heat and cold manifesting simultaneously. These patterns can occur when a person with a state of interior cold is invaded by exogenous heat or vice versa. There will be symptoms from both the exterior invasion and the interior imbalance. There can also be a combination of hot and cold symptoms when an illness is changing character. This could, for example, be when cold in the exterior is penetrating inwards and becoming yangming heat. Pure interior imbalances can also result in combined hot and cold patterns. There can be situations where there is heat in the upper part of the body and cold in the lower part. In this case, there will be heat symptoms in the top half of the body and cold symptoms in the lower part. It could also be the other way around. But usually heat will rise upwards and cold will sink downwards due to their yang and yin dynamics. There can though be situations where there is cold above and heat below. This could be when there is an invasion of exogenous cold in the stomach with such symptoms as watery vomit, abdominal cramps, and no thirst, while there is damp heat in the urinary bladder with symptoms such as painful urination with dark, odorous urine. Furthermore, there are also extreme situations where there is false heat and true cold, and false cold in true heat. It is important to differentiate these two situations from the one described above, in which there is just concurrent heat and cold. Furthermore, false heat or false cold is not the same as empty or deficient heat or empty or deficient cold. Empty heat and empty cold are when there is a deficiency of either yin or yang, resulting in a relative excess of heat or cold. When there is false heat and false cold, yin and yang are in the process of separating. This results in false symptoms of heat or cold. When there is, for example, empty heat, as in yin deficiency heat, the deficient yin is not able to control heat. This means that the person is hot at night and has red cheekbones, night sweats, a red tongue without coating, and so on. In this situation, there is heat present and it is arising because yin cannot control yang. When there is false heat and true cold, there is almost no heat, but the patient still manifests signs of heat. This is because yang has become detached from the yin, and the little heat that there is rises upwards in an uncontrolled way. The tongue is the most reliable diagnostic tool in this context because it will show the underlying imbalance. It is essential to treat the true state and not a false manifestation. Fortunately, these situations are rare and not something one encounters in a normal practice, but are more likely to be seen in an intensive care unit in hospital. Deficiency and excess imbalance. In deficiency and excess imbalances, we are differentiating between the relative strengths and weaknesses of the pathogenic qi and the body's zong qi. When there is a deficiency condition, one or more of the vital substances or internal organs is in a weakened state. There is no pathogenic qi present. An excess condition is characterized by there being either pathogenic qi present or a blockage or stagnation of one or more of the vital substances, but the body's zhang qi is intact. In clinical practice, there will most often be a combination of deficiency and excess. Nevertheless, it is still crucial in this situation to gauge the relative ratio of how much deficiency, and how much excess there is, and what it is that is deficient, and what it is that is excess. Thank you for your attention.